Good morning. In continuation of my series of presentations on imaging, today we will take about X-rays and CT. And these are topics based on the requests that I get from students, especially just before NEET. I don't want to be discussing old topics. I pick up questions which are repeatedly asked and try to make a presentation around those MCQs. So we talked about ultrasound. Today we'll talk about imaging. It is not the exact way of how you would diagnose things in an imaging. It is more to do with the risks of imaging. How you look for things in an X-ray or you look for findings in a CT or a PET we'll be taking in other presentations. But this presentation is basically to emphasize on the risks of imaging. So the common questions about risk of imaging was, what exactly is the risk? What is the index risk? What are the organs involved in this radiation? What exactly are the problems or the advantages of portable X-rays? You would have seen portable X-rays. And where do you get the highest radiation exposure? We'll take up all these MCQs one by one. So coming to the first MCQ, let me give you a case scenario. This is a lady, as I told you, all these imagings, except when I've mentioned, they belong to my personal collection. This is an elderly lady. She's come with a large intra-abdominal lump. So the next logical thing will be to get a contrast CT. So a contrast CT has been done. My objective today is not to go on talking about the findings in the CT. That is not the idea of this presentation. She has gone for a contrast CT. Now, the incidence of serious complication while using contrast in imaging, it need not only be CT, it could be IVP, it could be your angiograms, so venograms. So, contrast being used in imaging, what is the risk? You have this. This is a pure recall answer. There is no need to have too much of concept in this. So, serious complication using contrast in imaging. Let's have a look at the answers here. Serious complications can happen like anaphylaxis or even renal failure. Sometimes you can even have these things can be even life-threatening. That is 1 in 25,000. That is why you give a contrast, you ask them to be nil orally. Even for an angiogram, they need not be nil oral. You're not going into the GI tract. But why do you keep them nil oral? Because in case there is anaphylaxis, you will be able to handle it as an emergency. You want an empty stomach to intubate. All those things are there. Now, so serious complication is 1 in 2,500 and life-threatening. Your question was, what is the serious complication? So this is your right answer. Now coming to this is life-threatening. If they change the stem to life-threatening, then you need to go with this particular numerical. Now all these questions are from Bailey and Love. The subject matter is from Bailey and Love, and I have made these MCQs very personally. It has not been taken up from any other question bank. Now these two have been just put as distractors. Just some numericals have been put in the options to distract you from the main option. Okay. So organs particularly vulnerable to radiation during image are all of the following except, so read the stem carefully. Is it the eye, gonads, thyroid, or major cranial nerves? The answer is, it is major cranial nerves. Nerves are resistant. That is why you will find most of the nerve tissues or nerve tumors, they are resistant to radiotherapy also. Not all of them, but by and large, they are resistant. But the thing is, nerves are radio resistant in adults only. In fetal life, they are sensitive. Now to highlight this, I just want to give you a case scenario so that it will be in your head. When you know it is sensitive, it is resistant, at the same time it is sensitive, this sort of issue will imprint better. So this is a lady who had a head injury, and she was pregnant, coming for antenatal follow-up, and she was hit by a vehicle, came in a drowsy state, had to go ahead and do a CT. On the CT, you find an extradural hematoma. Now, the idea is, I'm not going to tell how to look for an extradural hematoma or why did we go and do CT on this lady, the importance of doing a CT on this pregnant lady so that we don't miss life-threatening events and all that. That's what we are not there for now. We are going to talk about the risks involved. So the fetus, yes, because of the radiation, the major nerves are likely to be involved. That does not mean that you will not do a CT on this patient. You will do, because the benefits far outweigh the risk. This, if you keep in mind, you will know where you will use investigations, how you will use investigations. You will see whether there are alternatives to use the investigations and places where you will avoid or even contradict investigations. So what about portable x-rays? Sometimes you will be calling portable x-rays to the room when the patients are very sick, like in the ICU or in the emergency departments or in the trauma care units or in the even sometimes in the post-operative wards. Now, these machines, do they emit less radiation? They are definitely needed for bedside evaluation. You cannot be sending sick patients down. Resolution is less than conventional units, and none of the above. So what exactly is true? What is true in this? If you look at it, it is needed for bedside evaluation. Resolution is less. Only thing is, you tend to think small machines, less radiation. No, the radiation is more. Let's have a look. So the answer is, because it is except, the answer is they emit less radiation. So that is why staff and other people in the room should be very, very careful also. You would have seen the radiographers when they come into the ICU or in the emergency areas in the hospital, they would make sure everybody goes out. They'll keep telling X-ray, X-ray and asking you to move out. So now I want to, coming to resolution is less than, I want to emphasize this. Resolution is less than convention units. Look at this bedside. Look at this X-ray. I mean, you can pick up serious issues, no doubt, but you see the definition, the lines are hazy between the heart border and the lungs. But have a look, the same patient, when the immediate management was reasonably addressed, was sent to the X-ray room for better X-rays. You see the definition. You see the resolution of, see how well the diaphragms are there. This is the, so portable X-rays, always resolution will be less. Now, that doesn't mean you will send everybody to the X-ray room. This patient at that point deserved a portable X-ray. You must be able to pick up serious issues in the portable X-ray with its shortcomings. So the idea is to know exactly what are the problems, what are the benefits. There is a big benefit of doing a portable X-ray in this patient at this point of time. But again, the benefits are much more in the patient once he is stabilized and you send him to the X-ray unit itself. So the next question is the imaging with the highest radiation exposure. It is measured in millisievert. It is a unit used to measure the amount of radiation a person absorbs, also known as the effective dose. So now, what are the modalities which are giving the highest radiation exposure? Is it CT chest, intravenous urogram, or a CT abdomen and pelvis, or a barium minima? For that, you must know the amount of radiation exposure in each imaging. Let's have a look. A CT chest will give 8 MSV. Intravenous urogram will give 2.5. A CT abdomen and pelvis will give you 10 MSV. And a barium enema will give 7 MSV. Now, you must understand, so if you look at it, the right answer is CT abdomen and pelvis. Now, the rule of thumb, anywhere you find CT, you're sure it is going to give a lot of radiation. Between the areas, if you're getting, then you need to work your mind across the MSVs. Otherwise, between X-rays with contrast and a CT will always score above. Keep that in mind. But if there are two CTs in the same MCQ, kindly try to tease the answer. So this is it. So thank you all. We have addressed about 4 MCQs. I'll keep doing this till your NEET exams, and hopefully I will be able to bring in those pictures and some little bit of background descriptions so that you don't end up mugging. It's a little difficult to keep on mugging everything and trying to learn by rote or versus using mnemonics. For every single sentence in your textbook, you cannot afford to use a mnemonic. So try to get into the concepts, and hopefully you will remember them for a very, very long time. Thank you. And again, I ask you to share, subscribe, and like. And please do join my Telegram group. Thank you all. Signing off.